Ms. Phillips. I wanted to introduce myself. I'm Mike Schneider.
Hi.
I'm the physical therapist going to be examining you today.
Yeah.
Would it be okay if I called you Sarah?
Sure.
All right, we're pretty informal here. Okay. Yeah. So, I see Dr. Bernstein's sent you over here, for a physical therapy examination. And before we get started with the exam, I just wanted you to kind of review, your history here over the past few months, what you've had done before, and just make sure I got the facts straight. Would that be okay?
Sure. I was rear-ended in my car about 6 months ago and noticed pretty shortly after that some pretty bad neck pain and headaches and stiff neck and hard time sleeping, those kinds of things. So I actually went to physical therapy already, but the exams were just way too intense for me. It made me feel actually worse after, so I stopped. And then I started taking a lot of medication, and I even had some shots in my neck, but none of that seemed to make it much better. And now I actually feel like I feel achy all over my body and weak and fatigued pretty much all the time. So I'm a little apprehensive about starting physical therapy again, but you come really highly recommended, and so I'm willing to try if we're able to go kind of gently.
Okay, well that's actually the purpose of this, our discussion and the examination. I kind of have to figure out what's going on with you before we develop a treatment plan, and when we do that, we'll do that together.
Okay.
But from looking at your notes, it seems to me that you've been complaining more of right-sided pain. Is that correct?
Yes.
Okay.
Yes.
So, and you've been having some headaches as well, and a little bit of pain in your right arm and shoulder.
Yeah.
So it's kind of predominantly right-sided.
It is, but I also just feel achy all over. But you're right; it's heavier on this side.
Uh-huh. Yeah. So when I noticed you fill out this pain diagram, it looks like although it's mostly right side, you're having pain like sort of all over your body now.
Yeah.
Yeah. Was it that way when right after the accident, or has that kind of developed gradually over time?
I feel like it's been more gradual.
Yeah. Okay. So we're going to look at that during the examination. You might actually have kind of two problems going on at the same time. Something localized to the right side of your neck, and maybe something else that's causing this fatigue and overall pain.
Yeah, that makes sense.
Yeah. Okay. Great. Are you ready to get started with the examination now?
Sure.
Okay. We're going to start our examination with a visual posture exam of Sarah, starting from looking at from the anterior to posterior view. We're going to look mainly at if there's any head tilt, and her head's tilted slightly to the right. We're going to look at the level of her shoulders, and we see there's a little slight elevation on the right side, and a little bulkier tone to the muscle here. Then we'll come from the side view and assess for the cervical lordosis in the thoracic region. We don't see any excessive kyphosis or winging of the scapula. So most of our findings we noticed from the frontal plane. Okay, Sarah, could you have a seat for me now, please? We're going to continue the examination with a general cervical range of motion examination by having the patient go through all the active cervical ranges of motion. So Sarah, we're going to start off by moving your neck in some different directions. Is that okay?
Sure.
Okay, can you bring your chin down towards your chest for me?
Just about that far.
That's about it, huh?
Yeah.
It hurts.
Hurts a lot.
Yeah. Okay, could you look up, like as if you're looking up at the ceiling?
Yeah.
That hurts too, huh?
Yeah, that's too much.
All right. Can you bring your right ear towards your right shoulder? That hurts too, huh? What about left ear towards left shoulder?
It's a little better, but that's still about as far as I can go.
Right. What about if you kind of look over your right shoulder? That's about it, huh? How about to the left side?
Right there.
So it seems like everything kind of hurts, huh? No matter which way you move it.
It all hurts, but the right side hurts a little bit more.
I see. Okay. So we notice on the cervical examination that the patient has pretty extreme limitations of all ranges of motion, although she complains a little bit more pain locally on the right side. The next step is to perform a physical palpation of the muscles and joints of her cervical spine. We make sure the patient is seated in a relaxed position. This exam could also be performed supine, but for the purpose of this demonstration, we'll do it seated. I'm going to just palpate now the patient's neck and trapezius region. That bothers you, Sarah?
Yeah.
Okay.
Could you be a little more gentle, please?
Yeah, I'll try. I just want to let you know that I'm already trying to be gentle, and the amount of pressure I'm using is probably less than I would kind of use with a normal patient, but so you must really be in a lot of pain.
Yeah, I am.
Yeah. So I'm going to try to go a little bit lighter, but there's going to be certain spots that might hurt a little bit more than others, okay? Just to warn you. So I'm going to start off just examining from the upper cervical region down paraspinally, just generally assessing for muscle tone. And I feel...
That's really painful.
Yeah. What about here on the left side?
Yeah, but not as much.
Uh-huh. It feels kind of hard and ropey.
Feel that, yeah.
Do you feel that hardness there?
Mm-hmm.
What about over here on the left side when I do that?
It's not as much.
It's tender, huh?
Yeah, it still hurts, but not
But not like this one, huh?
Mm-mm.
Yeah. So I'm doing a cross fiber palpation. I can feel a taut band of muscle tissue here, and it's very discrete nodular feeling. Where do you feel that, Sarah?
Oh, I think I can feel it kind of in the back. Oh, back in the back of my skull here on the right side.
Uh-huh.
It's kind of like giving me this headache.
So it doesn't just hurt here?
No.
Right. This is a very characteristic referred pain pattern of the upper trapezius that we're noting, where the patient's feeling it radiate proximally into the occiput and skull. Sarah, you also said your shoulder and arm kind of hurt a little bit too, on the right side only?
Yeah.
Yeah. Let me feel some of the muscles around your shoulder blade now, okay?
Mm-hmm.
So I'm going to examine now into some of the posterior shoulder muscles.
That really hurts.
And I find a taut band out here in the infraspinatus, teres minor area. How about the other side over here?
I mean, everything kind of hurts, but not like this side. This side I can actually feel it or just radiate down my arm.
Uh-huh. So when I press on this, where do you feel it?
Oh gosh, it goes like all the way down to my elbow.
On the right side. What about when I press over here?
It's not the same.
So again, we're finding a very discrete area of taut band and tissue texture change in this muscle with a referred pain pattern that's characteristic for the infraspinatus. We're going to assess, because this patient's had a history of cervical disc protrusion that was noted on MRI. She had an epidural injection, so we're just going to quickly assess her reflexes and muscle strength of the upper extremity to make sure she's not showing any signs of motor weakness. So I'm going to come mainly to the involved side. Is that tender? Yeah. You know, Sarah, I'm just going to check your reflexes real quickly here. Instead of using a reflex hammer, which might hurt, I'm just going to use my hands to try to be a little more gentle. Right? So
Yeah.
that was painful, huh?
Really painful.
Even with that light amount of pressure.
Yeah.
So, how about when I do this?
Yeah, it's all painful.
She has normal reflexes, but she's showing this exaggerated pain response. What about here? That's painful.
Yeah, could you be gentler?
I'm trying the best. Imagine if I was using a reflex hammer, what it would feel like. So yeah. I'm trying my best. Let's check your strength now of your muscles. This is not a strength contest with me, but as I try to straighten your elbow, don't let me do that, okay? Just.
Oh, I can't do that. I can't do that. That's too much.
Okay. Well, let's leave that one alone. With your elbow bent like this, can you kind of push down like you're trying to straighten your elbow against me?
It's as far as I can go.
Is that because of pain or because it's weak?
It's pain.
Can you try a little harder?
That's really it.
It's too much. And again, it's pain, huh? It's not that it's weak.
No, it's
I see. What if I bring your wrist up? Just bring your wrist up for me, like this, in this position. You just hold it there as I try to. Again, that's pain. It's not weak, huh? What if you push your wrist down against me? Try to. Okay. I think that's enough information. So we find that the examination of her reflexes and muscle strength is confounded by her widespread pain, which is probably related to her diagnosis of fibromyalgia. It's very hard in a patient like this to assess if there's true weakness or that the pain is confounding what appears to be weakness. Since she's not complaining of any numbness, tingling, or weakness in that upper extremity, I'm going to call this a negative neuro exam, although knowing with her widespread pain, it's equivocal.